Hi, welcome back, everyone. Um, I think I saw a lot of very active project groups, and I did not try to burst into every room, but there was a lot going on. And thank you for your contributions, not only to the meeting in general, but to genomic education, and we really appreciate that. I have a couple logistical things to pass on, and then we will jump into the summary effort of the project groups. We know that a few of you drove, and if you did, we have all-day parking passes available. Most came by other means, but if you do, I think our process is going to be, Roseanne, is that right? Okay, she needs the numbers. I think, did you raise your hand, Emily? Okay, that's great. Thank you. Let's see, what else can I announce here? Any specific questions? We're using a lot of new technology, so we have a lot of very responsible folks who are doing a little more to get ready. Are we all set over here? Okay, and our wonderful branch chief is, are you ready for this?
Yeah, I'm ready to get started.
Okay, so.
Go last, so.
Why don't we see if anyone is ready to go?
Okay.
There you go, there you go. Who is ready to present their summary from the project group that they attended?
I can go if nobody else volunteers.
There was a voice. Let's see.
Wesley Patterson from the Rare Disease Group.
It's
Sorry.
Wes from Rare Disease.
It's Wes. Did we hear?
Yeah, he's doing, because Sabrina had to step away. So Wes will be
Okay.
doing the Rare Disease summary.
Okay, Jacob, you get the rare disease. Okay.
Is it okay
Okay.
if I go, or does someone else need to go pressingly?
I'm sorry, I couldn't understand the vocals. There we go. Is that right?
Can you guys hear me okay?
Is that a yes?
Yep.
All right, yes, we can hear you. Thank you. And please
right.
introduce yourself as well. Thank you.
Yes, my name is Wesley Patterson. I'm a PA at the Greenwood Genetics Center in Greenwood, South Carolina, and I am part of the Rare Diseases Group. Sabrina Malone Jenkins is the chair of our group, but she had to step away for another engagement, so I was going to present our update on her behalf. Let's see, is this in the correct view, guys?
As far as I can tell, you're good, right?
Perfect. All right. So as I mentioned, this is for the update for the Rare Disease Group. I will try to keep it brief. In the past, we have done a workshop at a couple different conferences. We did the workshop at the Pediatric Academy Society, a train-the-trainer workshop at ISON, which is the International Society of Nurses and Genetics. We also did a workshop at the American Academy of PAs about a year and a half ago, and then a workshop at Children's Hospital Neonatal Consortium. And so in the group, we kind of went over our current curriculum. We kind of talked about some potential edits and revisions, and also a potential plan going forward. So looking at workshops in the future, we're hoping to submit a proposal for AAPA, which again is the American Academy of PAs conference in Denver, Colorado for 2025. I'll take the lead on that one. And then we're also planning on presenting a conference proposal for the Pediatric Academic Society for 2025, and Sabrina Malone Jenkins, she's going to take the lead on that one. We also talked about potentially having a proposal for the American Academy of Pediatrics, and Pamela Trepane, she's new to our group, and she's also a liaison for AAPA, or excuse me, AAP, all the acronyms. And so we talked about a potential workshop for there as well. Other societies, other conferences, other organizations we talked about, because with the curriculum that has been developed, we can kind of manipulate it and kind of translate it for different organ systems, for different parts of the body, to kind of incorporate that genetics education. But other societies that we talked about were the American Academy of Child and Adolescent Psychology, American Academy of Neurology, the Cognitive Neuroscience Society, American Epilepsy Society, American Academy of Pediatrics, which I mentioned regarding Pamela, the American Heart Association, and the American Dental Association. I will say a positive with this group, it does seem to be growing, and what is very exciting right now is we've had a variety of specialists join the group. So we've had, of course, genetics folks, we've had neonatologists, a pathologist, and now a pediatric cardiologist, neurologist, and we're kind of expanding and getting multiple disciplines. So I think this multiple or multidisciplinary approach for this type of conference is going to be very impactful in the future. And then other things we talked about briefly was particularly targeting training programs, specifically neonatal, perinatal fellowship programs, or pediatric residencies. Coming to a close for our meeting, we also talked about potentially developing and launching a needs assessment. And the needs assessment may be targeted towards these programs, so neonatal, perinatal fellowship programs and or pediatric residency programs, to kind of see what is the need, what do these programs hope to get out of it, and what can we do in order to help them with their curriculum. And that summarizes our group. And I'll take any questions.
Any questions for Wes Patterson online? Okay, I do want to point out a couple things that we included a number of new members in ISCC-PEG in your project group, if I'm not mistaken. Several that were involved in ISCC-PEG for some time, but I noticed that Dr. Pamela Trapain, if I'm correct, is our new AAP representative. And if I've missed anyone who's brand new from our associations, please let me know, because this is something that's so important in our work here. Not to mention the genomics, okay, but I do think the connections to our societies really make a big difference. I happen to be talking to Dr. Usuf, who can raise his hand, and he's a representative for CAP, correct? Grace as well? You're a new member, I believe, right? Okay, maybe not. It's kind of hard to, yes. Anyway, and I don't want to, miss anyone who's fairly new. Grace is not. She's actually been on our roll for a while. And of course, we've already introduced our 6 scholars. And I realize I'm jumping into this a bit late, but we do have Bansari Rajani is the co-chair within the year, I believe. And Kelsey, is that true for you as well? The LGBTQ group. If I've passed over anyone, please let me know. All right, so now we're moving on to the next person who happens to be ready to provide their summary. All right, Rebecca.
Great, thank you. I'm Becky Crump from Pittsburgh Duquesne University, and I'm standing in for Trina Walker and Ann Erstig, who are the co-chairs for this amazing group. We're the Nursing Genomics Project Group. And this is our major aim, is to support the integration of genetics and genomic in nursing education and practice at all levels. And our focus is on nursing faculty and practicing nurses from novice to advanced. And then we spent some time today just redoing our goals for next year. We're going to disseminate and translate resources developed by ISCC-PEG Nursing Group, and I'll tell you a little bit about those projects in, I think, in another slide. We're going to advocate for and showcase the role of nurses, whoops, you can go back, and an interprofessional healthcare team to provide genomics-informed care, and again, promote the integration of genomic nursing competencies. And we can tell you a little bit more about the projects we've done this year. On the next slide, we did an FAQ series on genome.gov, and it was for all levels of nursing, entry to advanced, to also nurse educators. We did an expert commentary on Genome TV and recorded a question and answer session for Healthcare Provider Genomic Education Week. And we just submitted an abstract for the graduate level for practicing NPs, and the undergraduate level is just getting ready to be submitted. So we have 2 manuscripts to be proud of. And for future plans, we had tons of ideas. We're not lacking in ideas, we're just lacking in focus right now. So it's going to be a work in progress.
I completely understand. I'm working on that same area.
And there's our next meeting for May 14th.
Okay, terrific. And I'm not sure if our other nursing genomics folks who contributed are also online, but thank you. It was several here? Yeah. Raise your hand if you're also in the nursing. Okay, great. Thank you.
Donna,
Yes,
if anybody needs the link to the next meeting, just have them email me and I'll put my, and so they should be able to access my information. I'm pretty easily found and my name is on the agenda, so.
That's Ann Ursig.
Yep, sorry, this is Ann.
yes, yes. And I do want to encourage all the groups will be open to new members. So we were able to walk around the hallways in person, which of course was exciting. But if you're online right now, that is not a reason to stop, reaching out and see if you can join these great groups. Okay, let's see. Who's ready to present their summary?
Nobody volunteered, you can just pull the next one out of the list.
Sure, sure. So Dr. Empey's ready to talk about the pharmacogenomics group. Phil Empey with pharmacogenomics.
Are we doing it from here or up there?
I think if you prefer.
Okay, I'm happy to do it from seating. So we have some slides. Yeah, so this is a presentation. Roseanne Donnelly and I are the co-chairs for pharmacogenomics. We had a really great discussion today with folks online and folks in the room, talking about not only our prior work for this past year, we're really proud of those modules that we got out, as well as some planning things for the future. So the big things for folks that are new to the group is we are finishing up a multi-year project where we are disseminating some pharmacogenomics online education modules. So these are modules that our group has put together, done some internal and external peer review, gone through ISCC-PEG leadership for getting approvals, and then we've worked on paths to externally disseminate for these to be taken free of charge if you're interested, but also if you're interested in the CE with a small fee for all healthcare providers, except for GCs. We're still working on getting that external approval. Those are hosted at the University of Pittsburgh through a partnership there and hosted on the genome.gov site. So we've published the first 4 modules. In terms of numbers of folks, we've got about 500 registrations altogether with very little to no marketing. Some of our internal group has done some marketing, but not any huge pushes yet for that because we're still releasing the next few. So we expect 3 more very soon, and then the last 2 will be coming after. So again, we're proud of that. If anyone is interested or going to a conference and wants to put up a slide for us, that's going to be on our ask here on the next slide. But again, we're pretty proud of those outputs because it's been multi-years in coming, and we discovered that path, or we developed that path of getting it disseminated through genome.gov. So, next slide, please. Oh, that might be one more, I think. Yeah. So our ask actually is to help disseminate. So many of you are play key roles in professional organizations. As we finish these up, we do hope that they are of value. We've heard there are some value to some groups, but if you're wearing the hat as being I'm the designated representative from X group, we'd love to ask, I guess, formally in HGRI and genome.gov, sort of if there's a process that we want to do that sort of more centrally or whether it's just group to group. But, we do have an asset that is being pushed by genome.gov, and it would seem like as we get these next few out, maybe just as we finish these up so we have the full subset, it would be a great time to maybe actively solicit people who might have the opportunity to talk to their organizations, because again, it's a free education and an asset I think that we're proud of. So, and then I guess the individual ask, again, if you're presenting in any meetings and want a slide, or even for the Education Week last week, we have a recorded webinar. We have a bunch of assets that we could push and help you help the organization push these. So thanks. Rose, anything that I missed?
No, that was great. Thanks, Phil.
Sure.
Okay, thank you so much. Did you want to add more, Roseanne? I mean,
No, that was.
you're good. You're good. Thank
I'm
you.
good. Thank you.
All right. Yes, it is good to see when we have a co-chair present. That's wonderful. Okay, who do we have next? Anybody ready to jump forward?
I can present for the OBGYN interest group.
Great, thank you. Was that Brianna?
It's Barbara O'Brien, and Brianna is going to bring up our slides for me. So,
Okay.
My name is Barbara O'Brien. I'm a maternal fetal medicine geneticist from Boston, and I'm the co-chair of the OBGYN interest group with Dr. Louise Wilkentag. And I want to introduce Brianna O'Leary, who's an MFM geneticist fellow in Boston at Brigham and Women's, who's been an integral part of our group for the past year. Today we had some new participants in our group, and it was very helpful and fruitful to go through our cases. So just as a introduction, next slide. What we did from the beginning of our group is we wanted to build a curriculum for OBGYN residents because there is really a dearth of curriculum for genetics residents in OBGYN. So we identified curriculum items through ISCC-PEG, through the working group. 5 modules and topics were built using those curriculum items that were identified. So we built 5 cases. There was an ultrasound case, a family history inheritance case, a carrier screening case, a cell-free DNA or NIPT case, and an ethics case. And thank you for many of the group members who helped us build these cases. So I want to just show you today the structure of one of these cases. So for each of these cases, they're all modeled the same. And the objective of these cases is to disseminate them nationally for a national genetics curriculum for OBGYN residents. Because as we know, there are not that many genetic counselors, maternal fetal medicine, or geneticists around the country to be able to teach the genetics curriculum items that OBGYN residents should be able to learn. So we built objectives for each case based on the curriculum items that were identified for many of you who filled out our Delphi survey that identified the curriculum items. We made an introduction for each case, and we gave them a toolbox of resources that were provided to the learners prior to the case presentation. So it was a flip the classroom style type of learning module. There are 3 exercises in each module. Learners are divided into groups for team-based learning, and they complete the exercises assigned, and then they come back to the larger group to discuss each exercise as an entire group. So the benefit of the group is made. Next slide. So I wanted to go through with you just one case so that you see how much goes into each one. So this is the ultrasound case just quickly. I won't go through all the details with you, but the objective is to compare and contrast different genetic and cytogenetic testing methods. For example, karyotype, FISH, genotyping, targeted gene panels, whole exome sequencing, and whole genome sequencing. We want them to define the variant annotation, benign, pathogenic, uncertain significance, and recommend applicable ancillary studies, services, consultants, and interventions in the context of the reported findings. We give them a toolbox that they should go through prior to the case, so as their kind of homework. So this is showing them all the tools in their toolbox that they have at their disposal. So the ACOG committee opinions, different articles of interest. We usually give them 2 articles for each case. So best practices for variant calling, variant interpretation. These are the 2 for this case. Next slide. So we give them an exercise. And remember, there are 3 exercises for each case, but they're divided into 3 groups, so they only do 1 exercise. Now, each case is an hour long. So remember, they only do 1 exercise, so they do have plenty of time to go through it. So we give them a clinical scenario. This is a patient that's 20 weeks. Her ultrasound shows anomalies, bilateral cleft lip, palate, left choroid plexus cyst. And then she goes under additional imaging, which finds bilateral cleft lip and palate, so forth and so on. Next slide. And then she Googles it and finds that she may have trisomy 18. We want them to know what the prenatal phenotype for trisomy 18 is and what else is on the differential diagnosis. And then we go through some testing that she may undergo. So she undergoes NIPT. We want them to figure out how they would counsel her about the possibility of trisomy 18, and she gets referred for testing. We want them to know through, sorry, if you can go back to the next slide. We want them to know the false negative results for the common aneuploidies. Next slide. And she then pursues through diagnostic testing, and that comes back negative, and we want them to then go through a microarray and whole exome sequencing. Next slide. Okay, so I won't belabor the point, you get it. We give them a microarray result so that they, as a resident, they then go into attendinghood, right? And they need to actually see the actual results. So we give them the actual results to interpret. Next slide. That comes back negative, and then they have a result of a prenatal whole exome sequencing, and that comes back positive. Next slide. And then we want them to be able to interpret these results and to explain the findings. Next slide. And then we go through some other questions that they need to answer. Next slide. All right, so the next steps in our project is we want to refine the cases based on the feedback from our working group. And today we went through probably about 3 of the cases, and we did refine the cases based on the feedback from our group, which was wonderful. So the asks for you are, we want to trial it. So we want to trial it through the 2 institutions that Louise and I work at. And we want to do a pre and post test, and we want to get the feedback from you guys about how to assess it. So we want to do a pre and post test. Are there tools out there to assess pre and post tests? So we want to validate the teaching. So are there validation tools to validate teaching in a small sample, quantitative or qualitative? And then the second ask is, where should this live? So should it be on APGO, ISCC-PEG? Where should we keep it? And we need to also keep it current. So any feedback that you can give us on those 2 questions would be wonderful.
Thank you so much, Dr. O'Brien. Do we have any other feedback for her? Specific questions at this point, or? Are you ready?
Well, I'll just mention, Barbara, I think you're looking to, get more people on the group, correct?
Yes, absolutely. We would love for more people to join the group. I know it's been a very slow progress with getting this off the ground. But we are really actively progressing in the project. And so the more people that can join, the better. That would be really wonderful.
Excellent. I know there were a few people who were joining, certainly through our scholar, Ava, and you are her mentor. So thank you. Okay, can we move forward? Thank you. Do we have, I believe the LGBTQI plus folks that came with you? Yes, and if you're ready to jump in?
I can now. I was giving Jacob a hard time. Oh, yeah.
Hello.
Oh, yeah.
Yes. And Kelsey's going to chime in to help out as well. All right. Thank you, everybody. Yeah, so this is a brand new group-ish. I'm going to call it a group-ish because we are many groups and also a side project for our branch. So thank you for being flexible with us. Oh. Can you find my slide deck? So, yeah. Good. Thank you. Great. Here we go. So our conversation, as I kind of hinted at, we brought together the LGBTQI group and the inclusion and practice group. So thank you to Shumita and Maya for joining our little team, knowing that all of these issues have some core things in common. So you can go to the next slide. And so the first thing that we kind of started to talk about was like who are our communities, needing to name and define, and just how like intertwined and interwebbed engagement around patient education, provider education, patient-provider interactions, community engagement, research engagement, all of these things are all intertwined. And so we just wanted to like name that as part of our thinking about how we're going to approach the program or the initiatives that we'll think about. And then kind of with those thinkings in mind, we talked a lot about how important it is to meet people where they are and making sure that we understand what they actually want out of their education or engagement. And we talked a lot about methods, best practices, and sharing across different professions. Language access was a clear theme that came up quite a lot. And this concept of trust and trusted messengers within communities, and how do we make sure that we're leveraging trusted messengers as a really, really critical piece of community engagement. We also talked a bit about media literacy and thinking to make sure that whatever we develop really does have benefit back to community. So those are some of the core themes that emerged from our chat. Next slide. And so we proposed 3 projects. The first would be to do a scoping review where we would kind of explore what NHGRA has already funded with respect to community engagement and health equity and other potential projects that have emerged, especially on our extramural side, but also just other things that have come up. And then we'd love to do a curation exercise. You want to share a little bit about that, or should I? Yeah. Keep going? Is it okay? Should I just keep going? Sorry. So one of the things that we all recognize is that there's a lot of good stuff out there. A lot of people have already developed tools, toolkits, methodologies, community forum practices. So we want to make sure that we capture that and use that and don't recreate the wheel. So we'd like to do a curation exercise to pull together those resources. And then the final thing, again, is thinking about the dovetailing of the work that Maya has already been doing along with the others in our community engagement working group. They've got a paper manuscript in draft form around clinical decision making and intersectionality with respect to these issues. And so we'd love to recruit a few folks to help finish up that paper and think about the clinician's perspective as well as the patient's. So those are some of our proposed initial projects. Next slide. And so again, we talked about the resource curation process. We would love to know what you all know. We'd love to know what you all have in your tool belts. And so again, kind of thinking about tapping into you all as an expert knowledge group. We'd love some time, maybe at an upcoming plenary call, to discuss and curate those resources in real time. If you guys can just like drop links in chats and things like that, we can do an exercise where we can curate together. And we're also planning to send out some sort of survey. We'll try multiple modalities in the hopes that we can gather as much information as we can. And then if anybody does know how to get tech savvy and develop a web crawler for us so that we could just like have the internet find all these resources, that would be lovely. It was Molly's wonderful idea. So yeah, anything like that would be great. So that's where we'll start. Yeah. And then, and so last slide, one more. So yeah, again, we also talked about timelines and how important it is to have something that is achievable and time limited. So our goal is to have this scoping review and curated resources before we come to our next meeting together. Yeah. Thanks.
Thank you. And now I'm turning my mic on. Sorry, didn't earlier. We have DTC and rare diseases. Who would like to?
DTC can go. I'm here, Tracy. I can do DTC, or Aria and I can do DTC.
Sure.
If Aria is still here.
I'm here.
Excellent. Okay, so this we put together on the fly, but so this is our direct-to-consumer genetic testing project group to look at a bit of the things that have happened in the past. Next slides. The FAQ is the big thing. It is currently up on genome.gov. You can find it at that link. And there is the friendly URL genome.gov/DTCGTFAQ. We spent some time today going through making it current. And so we want to have that finished and sent off to Donna's people so that they can update the web page and get that finalized. So we've got version 2 up there. Next slide. We are still awaiting information on the Mayo Clinic proceedings paper, collaboration with PGX. Roseanne Donnelly is the first author on that. It has been slow going, but I think, well, we should be hearing something soon. Next slide. We are also working, for those of you who were at the ACMG meeting in 2022, we did a survey at a plenary session at that meeting where we provided 14 different situations with a bunch of recommendations for how primary care people should, or what they should do in a particular situation. And these are the 14 situations, and it's hard to see because the bars aren't very wide, but the agreement amongst the 700 participants, 700 or so participants, is relatively good, 60% or better. There are a few recommendations where we have some disagreement, and they relate to things like putting DTC into the medical record, about recommending that people go for referrals to genetic testing and counseling, that kind of thing. So that is ongoing. We are working hard on that. We've got some, it's going to be a mixed methods, qualitative and quantitative data that we are analyzing. Next slide. Next. The ask. So we have an idea that we wanted to broach to all of you. Next slide. As a project group collaborative effort, we think that there is a need for specialty related societies to have genomics content. And Maria, do you want to take it from here?
Sure. So the idea is that, you know, the different project groups have been working on some curricular content, modules, other learning material. But could we create some kind of package, a full package that is specialty specific, that includes what you all have been working on? For example, in our DTC GT group, we can aim for the American College of Physicians or the American Society of, I don't know, some other pediatrics or something. And so like we say about American College of Physicians, we can target internal medicine related content, for example, relate from DTC, from PGX, from rare disease, from cardio, and present it as packaged learning material for that specialty. We would create something that is also specialty specific for pediatrics, and nursing, any other group that we could think would benefit from that. It could be even subspecialty like oncology, cardio. And this way, our collaborative efforts are kind of created and are presented in that package of genomic content that is relevant to the specialty and is comprehensive and includes the various fields that the different project groups have been working on. And with that, it would probably need a more central organization to oversee the specialty specific cases, and which project groups contribute content to these cases. Tracy, do you want to add to that?
And just the other thing is, from the perspective of the people here, how does that resonate with you? How do we get to the specialties and provide that content that is particularly relevant to them?
And to have buy-in from them, right? So that was one area that we discussed was, having buy-in, since we already have members, representatives in ISCC-PEG from those groups, could we have buy-in for that genomic content that may be more comprehensive, that is a product from all of our collaborative efforts?
I love that idea. And again, we have to, look at feasibility and timing and maybe it deserves another call sometime. And I apologize because I was looking at our new association members, but that was Aria. Did you introduce yourself already? Yeah, Aria, UBA. Do you want to?
Hi, I'm Maria at UVA. I'm a clinical geneticist based at Texas Tech in El Paso. And I'm co-chair with Tracy Weiler for the DTCGT project group, but she's been carrying the baton all today. She's been doing everything, so I'm just a shadow today.
She's
Very important
moving
one.
to Florida. That's why.
Yes, she's recently moved, right, Aria? Yes. So thank you so much, Aria. And I love that idea, and we've got so many ideas. We are going to have to sort through all these, but this cohesive one I particularly like, but that's not necessarily the vote we need. We need you all. But this is the end of our summaries that I was monitoring. Do you want to say more? Oh, I think I said rare disease, but we had someone else. Beth, is that what you said?
Yes, I presented for rare disease for Sabrina.
Yeah, that was Wes. Thank you. Yeah. We have a lot of groups, and this is, a good problem to have, right? Is that what we say? Yeah. And I have a couple things to pass on, but I want to make sure, Rich, do you want to comment on the summaries? And Emily?
Is there anything from the PA group?
Oh, okay. Oh, that's what happened. It was.
I would suggest that the PA group give a few comments. Thank you very much.
Rich. Wes is also a physician assistant, isn't he? So there was a
keeps
reason
going off.
for it.
Okay.
Are
Hi.
you
Do you have
guys
my
good with
slides?
that?
Also, while we're pulling up the slides, I think Siddharth had something he wanted to say in regards to the DTCGT group suggestions. So if you want to go ahead and do that.
Yeah, I love Tracy and Haria's suggestion, and our modules are available to anyone who wants to combine them in such a way. I think that's a terrific idea.
Okay, so last but not least, the PAs. My name is Wynn Park. You've all heard me talking the small but big voice, I guess, about the PA group. And we are the newest, well, I guess Beth's group is kind of the newest. Okay, so we're the newest group, and we have just started with some of our work, but we have been working in this space for a while. So next slide, please. Okay, so the first thing we talked about was making sure that our mission was understood because, as Rich said, we need to know what our goals are and then be able to think about the audience and then the timeline, and it's helpful to have that in terms of our mission. So our mission is specific to PA students and practicing PAs. Next slide, please. So the other thing we thought about is the work that we would do. And so as a project group, we were, again, looking at what Rich's suggestion was, which was timeline. So the project group activity was one thing that we were trying to think we could accomplish within the next year. And then looking at not only a project group, but also because, as Emily said, we have all these different constituent organizations, but we have like a specific nursing group or a specific PA group. And so we thought about how can we make sure that our goals are not just to accomplish our working group goals, but also how do we collaborate with everybody else? So to make sure that we have this interdisciplinary activity. And so obviously we'll be signing on to the DTCGT stuff as well. But I'm also part of that group. And then one of the things that we talked about was making sure that each group has a PA representative on your group. So if you don't have one, please do reach out. And that's one of our asks, but that's further down the line. So next slide, please. Okay, so we, even though, as I said, we are a small group, we had a pretty robust discussion about the different ideas that we had. One of them was based on one of our scholars, looking at assessment of PAs in training in terms of their use of medical interpreters. I thought that's a group that hasn't been looked at. We are also trying to figure out how can we help provide genetics and research opportunities for PAs, looking at the curriculum for genetic fellowships perhaps, and then we heard further about this genetic training pathway, which I'm sure we'll talk about more later. And then looking at how the Doctorate of Medical Science in PA programs and in the PA world has really grown, and so that might be a place where we could be looking at incorporating genetics curriculum also. We talked about applying for different conferences, and then looking at how we could maybe talk about a project on how medical behavior changes, looking at specifically PAs after receiving genetics education. There was a proposed PGX workshop for genetic testing at our next AAPA conference in 2025, and just so everyone's aware, the deadline for that is July 31st of this year. So if you're thinking about submitting something for the PA conference for 2025, it will open then, I think, and so don't quote me on that for sure, but it is July is usually when it opens up. So, and most people are like, oh my gosh, because the conference happens in May, and then you have a very short turnaround in order to be able to submit your conference proposal. Donna had asked us if we would be able to help out with reviewing existing genetics cases, and one of the things we wanted to be very mindful of is because these cases were developed, what did we say, 2017, 16, when was it? That we want to make sure we're looking at it from this diversity, equity, and inclusion lens. And then some of the topics that we had brought up, and one of the ideas that I brought up was bringing up this interdisciplinary review article regarding the state of medical education. So after the general discussion, next slide, please. We decided for our project group activity, we would do the cases for Donna, and then what we've already done is we've developed a 5-hour genetics webinar for this year's conference, and participating in that are Wesley, Melissa, who's part of our group, Jessica, who was here and is one of the ACMG Genomic Medicine Program Management Fellows, and Phil Empey, who's going to be doing a PGX talk for us as well. And this is similar to what Siddharth participated in last year. This, as I said, is our 4th year of this genomics workshop and webinar at our national conference. But then we also wanted to see if perhaps we could review the PA genomic competencies, but full disclosure, which I helped to co-write in 2016. And so we wanted to review that to make sure that it's still relevant, and then develop a genetics curriculum based upon a review of that. Also applying for the PAEA conference presentation. And then one of the things that we've started to do is reaching out to specific PA specialty organizations to connect them with other ISCC-PEG project groups. Next slide, please. So in terms of the interdisciplinary activities, we are definitely available to participate in the developing of a genetic training pathway, and the article is something that we would take the lead on in terms of beginning, and what we talked about was including a needs assessment from each parts of the genetics team, what's already been done, looking at highlighting resources that ISCC-PEG has already developed. And then I went and talked to everybody in between. And so currently the PGX group, nursing group, cardiovascular genomics, and DTCGT are all on board. And so we'll start a Google Doc and an outline, and then just start dropping references in and begin the article. Next slide. Things for other people to think about in terms of ways that you could be involved in the PA world as well. DNA Day is coming up very quickly. We have that genetics webinar. We are going to be planning for next year in terms of next year's webinar, Public Health Genetics Week, and then PA Week. And next slide. So our asks are, if you don't have a PA representative in your group, please reach out to us. We will find a PA to work with you. And please consider joining our group.
Thank you. It was comprehensive, and I did manage to have time to stop in, so thank you. All right, so now what I like to see is, my confusion was really because we're starting to integrate people into many different groups, so I think that's a great way, to consider what's next. I have a couple other items, and I think we have a few more minutes, but I wanted Rich to give any additional summary points for the project groups.
No, I think they're all, I mean, it's great the stuff that people are doing. I think, again, think about our membership and how to integrate things and getting, more input from diverse, either specialties or areas of medicine. So, but it's great, and I went to some of the groups, and it's great the level of interactions, and just keep reaching out if you have questions about how to move things along and stuff like that. But thanks a lot. And you had a few more things, or?
I also want to give our branch chief a moment. You
Okay,
wanna
sure.
Add anything there?
I guess we're still working out kinks with timing, but please do fill out the post-event survey. That's one thing I wanted to mention. So go ahead and screen grab it if you can, if folks can do that. And then, I think this meeting has given me certainly a lot of food for thought, and it's been really amazing to see all the hard work and creative thought that you all have provided. It's going to take me a beat to process it all and think through what do we do with all of this wonderful stuff and all of these wonderful ideas. So I guess my ask for you all is to be patient with me as I'm learning this field and to help me help you to do what you do best.
Thank you. Well said. Yes. We also made a significant effort with the help of not only our branch chief, but a number of other folks to pull in association and society members, which, as we were recalling when we were introducing ISCC-PEG goals and revisiting them, that's how the organization was originally built. And I do want to mention a few people who are in the room and acknowledge their contributions to, in the first place, just agree to this representation position in the first place. But also, we would love to have you even more involved than what we see right now. Okay, so I did have a chance to talk to Dr. Youssef, if I'm saying that correctly, who's here at the meeting itself in person. And he is from, I want to get the name right here. It's the College of American Pathologists. Not only coming here, but I think Dr. Hospital, our co-chair, played a significant role in connecting with him. I don't want to overstate, but he did all sorts of work on this.
No, I'll just say, I do some work with CAP, but if anyone knows an organization, so I happen to be a pathologist, and I know CAP's a pretty big pathology organization, and they do genetic stuff. So we have been talking about reaching out to groups to try to broaden our membership. So I reached out, but I'll reach out to anybody. We have I put together a letter that explains what we do. So, and we have actually a list that we're going to hopefully go through at some point. There's a lot going on. We had to prepare for this, but that was one. I think
there's actually several.
Yeah, there's several. Right. So we have our USP. I don't know if you had a.
Yeah, I can.
Right,
name
and
the names
I put it on. Some of them are groups. Some of them that were on the list you showed me are people we've had before. Mm-hmm. So there are definitely some new groups, like I think G2NA, USP, I think, and CAP. And then there are some groups that we might have had in the past that we've reinvigorated. Actually, I think CAP was in the past, but I didn't realize that until I looked. But I think we've reinvigorated some other groups like I think the American College of Physicians, for example, American Academy of Neurology. So the idea is we've been doing this process of when people have to step away because they have other things going on in their life. And when we notice that, we've been reaching out to the organizations to try to, is there someone else interested? And now we have new reps from some of those groups. But also we want to reach out to organizations that we might not have contacted before. And we have an active list that we're going to go at. But if you know places, great if you're a contact with them, and you can. But we can give you some, some prose, I guess, not that fancy, but I couldn't think of the word, some writing that explains what we do in a very, so we can help with that, because the power of this group is really the diversity. So, yeah, and we can send out later, like, you can look at that list I put together, and if there's someone I missed and who we should have welcomed, then we should definitely do that.
And
so.
I pulled up the same list that I sent.
Right. So.
And our AV people might be able to identify a few that are online. Is that possible? It was kind of last minute, of course, so if you can't understand. Or I can mention the organizations. I thought it was, an impressive increase. And these are on your 2023 new members. So we also have, I can name the names as well. Blaine Grote had come in from the United States Pharmacopoeia, and these are all new members this past year. Margie David came in as a representative from the Association of Molecular Pathology. We already mentioned Dr. Usef. He came in from the CAP, as pathologists call it, the College of American Pathologists. We had Wiley Burke come in as a representative from American College of Physicians. How about Andrew Dwyer coming in from the Global Genomics Nursing Alliance, G2NA. Khaleesi Logan from the Jackson Lab, and Emily's here. So is she a new representative, or you're both more than welcome?
Both, just like I think not attending today, but Kate Reed also attends mainly virtually. So I think Khaleesi's online.
Yeah, and Donna,
Gotcha.
if you want, it's probably, I did show the slide earlier. If you want to just put that up again, if that's what you're.
What I'm trying to do is put some names to faces, really.
Oh,
we'll
okay.
do more later.
So are all these people online now? Is that the idea?
No.
Oh.
But if they are, I want to recognize them.
Okay, all right.
And I think there's just one more. Kelly Rose from the American Society of Hematology. And she happened to be interested in representing as the chief scientific officer. I believe it was for training. Several of these we spoke to. But
Yeah, and if anyone, when you look through the slides, if there's someone we missed, I also already heard, I think some of our logos are out of date, so I apologize. So anyway, anyone we've missed, please let us know, and we'll definitely make sure we correct it in the minutes and the slide. So, but we definitely welcome everybody, and also the people who have been with us for a while, because,
certainly. Yes.
If any new person has any questions, feel free to reach out to Donna or me if you how this stuff works. And I encourage you to take a look at our policies, but if any questions, let us know. So should we?
Yeah, I think.
So I'll just say, Donna, do you mind if I say a few things? So this was like real. We had an in-person last year, but it was like coming off of COVID, and this has just been really amazing in terms of the engagement we've had and seeing some of the meetings and stuff. I think we had some really, just starting in the morning. Again, like I said, NHGRI is incredibly collaborative. We had the director of NHGRI, we had the director of, what's Dr. Solomon again, the director?
Clinical director.
Clinical director, and we had Dr. Manolio, who's also, we got directors everywhere, got Dr. Brody, everyone, so, but the idea is, I think that's really what makes NHGRI special and this group special. And then our scholars are doing some amazing work, and I'm glad a lot of you could make it, and anything we can do to help and to integrate you better into ISCC-PEG or help with your projects. I think there's already a few ideas that came up, so, and it's great you can join us. And then, the strategic planning was very interesting for me. I didn't know, Beth, did you have a couple of lines? Like, was there anything, did you want to mention? And then I can talk about ours just for 2 minutes. But it was great because Beth had this great idea to because it would be hard if we did it all remote with the locals, so we separated out. So did you have any?
Yeah, sure.
Yeah.
Thank you very much, virtual participants, especially for working through the clunky technology issues that we had, of course. But I appreciate you all being willing to experiment and try new things. And I do want to emphasize again, like everybody received those questions in the email that we sent out a couple of days ago. So if you want to low tech it, please just feel free to respond to any of those things that speak to you. Again, right now where we're at is really just like gathering information, trying to hear where are the high priority items, where are the unmet needs, where are the places where we can really serve as an amplifier for great work that's already happening. And so it's just, any information that you all are willing to provide on that front is helpful. It helps us make decisions based on the needs of the community. So thank you.
All right. So I'll just say a couple of things. I think a couple of the messages that came out at the strategic planning, and again, I appreciate everyone, the people who brought up things. I think we need to, about our dissemination was a key so for people who are online, I'm also, a bunch of people know that, but how to structure that maybe to really assist people in terms of, how can you find those conferences, or how can you find the places that can distribute the materials you make. Also, maybe some more guidance when people are starting project groups. I put up my slide, but we could probably have even more guidance for dissemination and things like that. And then there was some ideas with needs assessments and different organizations that we can ask about their needs. But I really think, really to me, I don't know about you, Donna, but to me one of the key messages was providing more resources to help disseminate stuff. And one idea that came up was, and something we've talked about, is even starting, you got to start somewhere, like a list of all of our organizations and when their annual meetings are and when they can apply for things for those meetings. I think that would be something as a starting point. So did you have does that sort of capture it, you think?
Yeah, sure. I mean, there's so much more, but
Right. Well, we only got like, I can't repeat everything. So there is, genomics is very straightforward. So it's, So I don't think, I think, I think we've already had a lot of discussion. So I'm not, I don't think we need to have more of that. But I know I have, some of us have to leave, including me, but I'm going to be around a little bit if people want to come up and talk, or if they have other ideas that they want to. We didn't have a lot of sticky notes, but we'll definitely look at the sticky notes as well, or any of the other stuff. But we'll stick around a little while if you have other thoughts. But I really want to thank everyone, and also NHGRI for all their support, for all our tech people who, I mean, this place is amazing, but to keep it running, I can only imagine. So it's really a lot of effort that went into this, and I'm just going to do it again. You should all give yourselves a hand for coming here. And please, please, please reach out if you have any, talk to us here, but email us if you have any thoughts, any ideas. We really want to hear from you, or how we can help. So thanks a lot.
And I have one more set of thanks.
Yep.
And I'll go through it fairly quickly. I'd like to raise the names of our team.
Sounds
we
good.
have Gerald Samani, and Jacob, I believe he's stepped out, sorry. Nancy Reed just joined our team. Big help. And I do think you'll recognize Roseanne Wise's name because she's been around some time. As in, we were the dynamic duo last year, and now we've up to 5. And as well, I want to introduce Jesus Aguilar, who we're going to get very busy, right? And you've already met our branch chief, Beth Tuck, who not only has great ideas, but she's jumped in so many ways I can't even keep up with it. And then the last thing did you get another cheer? The last thing I want to mention is we have the room till 5 p.m. And then we need to scoot out, but you can scoot out wherever you like after that. But I think we have to hit the 6th floor. Yeah. So, you know, it's a large campus. We're not.
We'll all go in Donna's office.
So this has always been very exciting for me, and thank you for all your work.
Meeting adjourned. Thanks a lot.
Yes. And fill out the survey, right? The survey.